Dr. Mark Schleiss. He is a professor of pediatric infectious diseases at the University of Minnesota Medical School. Dr. Schleiss, it's a pleasure having you on the show. Well, since schools began reopening in the U.S. this term, 1,200 students at the University of Alabama have tested positive for COVID-19. Hundreds at Kansas State University and scores at the University of Dayton. What are your thoughts on having all schools reopen?
I think that it's very risky to have a blanket recommendation for all schools to reopen. There's a lot of variation around the various states in the United States with respect to the prevalence of COVID-19. And so what may be doable in one school district or one state may not be safe in another state. I think we really have to individualize.
Meanwhile, the search for a vaccine continues. Reports are, Doctor, that hundreds of thousands of doses of coronavirus vaccines have already been manufactured in hopes that at least one of them might succeed clinical trials. Is there an update on President Trump's Operation Warp Speed that you could give us?
There are at least a couple of vaccines that are currently in phase 3 study to evaluate for efficacy. Realistically, I think it's unlikely that we would see a vaccine available before early 2021. In the meantime, we have to deal with major resurgences of COVID-19 in many states. Florida, for example, has had a whopping increase in infection in children, a 200% increase just in the last month, and they reported 700 new cases in school-age children just on Friday. So that's an example of one state where we may need to take a very different strategy than in other states. I would also add that in the dialogue about vaccines, we've ignored women and children, and we need to develop strategies to use the vaccine in school-age children and in women, particularly women of childbearing age. So there's a lot of work to be done, and we're not really close yet to solving this through vaccination.
Definitely. Of course, these laboratories are working at so-called warp speed to find a vaccine. Are you confident that one is manufactured, that it will be safe for use?
Yes, I am. I think that we need to be very cautious about safety, and that's one of the reasons why we shouldn't rush to give vaccines unless they're thoroughly tested. A bigger concern I have in the United States is the political activity of groups that are opposed broadly to vaccination in general and raise unfounded concerns about the safety of vaccines. I worry that this philosophy will trickle into the COVID-19 vaccine discussion, just as it has with outbreaks of measles infections and other kinds of vaccine-preventable illnesses in the United States. So we really need to emphasize safety and fight the political forces that are generally opposed to vaccination in many parts of this country.
Dr. Schleiss, we appreciate you taking time to speak with us here on TRT World. Thanks again.